GHK-Cu is a naturally occurring copper peptide complex found within human plasma that actively coordinates the body's cellular repair. This line graph maps GHK-Cu plasma levels over time, showing a steep drop from a baseline of 200 nanograms per milliliter at age 20, down by more than half by age 60.
Imagine a molecule that doesn't just cover up your wrinkles, but actually goes into your genes and activates the ones that have switched off as you get older. It sounds like something from a movie, but in 2026, the biohacking world is obsessed with a little blue peptide, and it's one that you'll have heard of. It's called GHK-Cu, or sometimes called the copper peptide. And you'll have probably seen this from your favorite skin influencer or beauty influencer or wellness influencer. But I'm a doctor, and I think it's important to actually look at the science and the medical evidence behind this so that you know exactly what you're doing to your skin and your body. So stay with me. You need to watch this if you're considering using GHK-Cu. So most of what you'll have seen online is its benefits for skin health. And we'll talk about why that is in a second. But did you know that GHK-Cu is being studied for anti-cancer properties? I mean, that's pretty exciting stuff, but let's get into it. So what is GHK-Cu? Well, it's a peptide, a tripeptide to be specific. And that means it's a tiny chain of 3 amino acids. It contains glycine, histidine, and lysine. But the secret sauce, as you've guessed from the name, is Cu, which stands for copper. As we spoke about in the previous video, peptides are messengers for your cell. And think of GHK as a molecular chauffeur. Copper is essential in your body to build collagen, to fix your DNA, to fight inflammation. But copper is also reactive. It's like a wild horse that needs a rider to control it. And GHK is that rider or chauffeur. It binds to the copper that's in your blood and takes it to the cells that need it. And when you're 20, your body is completely full of these little blue chauffeurs. But by the time you're 60, your levels have dropped by 60%. This isn't just a sign of aging, it's a cause. And without that little chauffeur, the GHK, your cellular repair crews never get the tools that they need to function. So let's look at the human trials. In a randomized double-blind study, women used a GHK-Cu serum for 8 weeks, and the results were pretty spectacular. Wrinkle volume decreased by 55.8%, and that wasn't just a slight improvement, it outperformed Matrixyl 3000, which is the industry gold standard, by 30%. And in the lab we see why. You see, GHK-Cu stimulates collagen and elastin at such low concentrations. And it's also powerful in hair growth because it increases follicular size and it improves hair transplant outcomes. And used topically, it has a 50-year safety record. For skin and hair, it's a 10 out of 10. But here's where it gets really interesting, especially for me as a doctor. Using the Broad Institute's connectivity map, scientists found that GHK induced significant change in 31.2% of human genes. And that shows that this compound is capable of genetic reprogramming. And when they looked at DNA repair genes, they saw a massive shift. 47 genes upregulated with only 5 genes downregulated. It's effectively increasing your cell's capacity to fix themselves after they've been exposed to UV or oxidative stress. It's almost like resetting your biological software back to the factory settings. Now we get on to the most controversial part, cancer. Most growth signaling peptides make doctors nervous because we worry that by stimulating growth hormone and IGF-1 they can potentially stimulate a cancer. But GHK-Cu is different. In metastatic colon cancer models, GHK reversed 70% of the 54 gene metastasis signature. So that tells us that it actually up-regulates tumor suppression genes and helps reactivate something called apoptosis, which is programmed cell death in these cancer cells. And it doesn't just stimulate growth, it stimulates healthy growth. And while we don't have any human studies to back this up just yet, the preclinical data is really encouraging. And this might be one of the few molecules that has anti-cancer properties. It's not often you hear that. So topical versus injectable, which is better? Well, here's what I would say to you. Topical GHK-Cu is incredibly safe. So should you inject GHK-Cu or should you just put it onto your face topically? Well, here's the reality in 2026. Using it topically on your face is completely safe, but once you start injecting it, it becomes a different beast. So even though animal studies show some protective effects on the liver, the lungs, and bone, we just do not have the long-term studies to say that it's safe just yet. Because remember, with peptides, you don't want it switching on genes that we don't know about, because that's when things can start to go wrong. So when you start injecting peptides like this, it becomes more of a risk. And it's a risk that you don't really need to take because the topical application does the job. So my advice is to stick to a high quality topical with about 1 to 2% concentration, unless you're under the direct supervision of a clinician of some sort who is monitoring your copper levels. We do see it from time to time, sometimes people with unregulated copper levels in a condition called Wilson's disease. And if you have that and you don't know about it yet and you take this, you're gonna give yourself a whole lot of problems. So what is the bottom line about GHK-Cu? So as a topical, it's a 9 out of 10 for me. It's got good scientific backing and it's extremely safe when using the concentrations that we've spoken about. But when it comes to injecting the peptide, the data isn't there just yet. It might be in the future, but more research is definitely needed.
GHK-Cu's primary mechanism as a powerful modulator of gene expression, dividing its repair function into 3 distinct pathways. The first pathway stimulates dermal fibroblasts to synthesize type 1 and type 3 collagen. The second pathway boosts specific growth factors, including VEF, to promote the formation of new blood vessel networks. The third pathway downregulates pro-inflammatory cytokines, while simultaneously upregulating antioxidant enzymes to neutralize oxidative stress. These genetic mechanisms function together as a systemic biological catalyst for comprehensive tissue regeneration. When applied to the skin, this targeted therapy effectively increases structural density and elasticity, while visibly reducing fine lines. In the scalp, the peptide prolongs the anagen growth phase of hair follicles, leading to increased density and strand thickness. Patient contraindications include active cancer, Wilson's disease, copper allergies, and pregnancy.